The Centers for Disease Control and Prevention on Monday walked back information posted on its website just 3 days ago, which stated the coronavirus can spread through aerosolized droplets. The CDC now says that Friday's guidance was posted, in error, and that new information will be issued shortly. The move is yet another misstep for the nation's leading public health agency, which recently reversed its guidance for the second time on testing asymptomatic people for the coronavirus. On Friday, an update posted to the CDC's website stated the virus can be transmitted through tiny, aerosolized droplets that are produced when an infected person coughs, sneezes, sings, talks, or breathes. That information was already well known, according to infectious disease experts. It was not surprising or jarring, Dr. Jill Weatherhead, an assistant professor of infectious diseases at Baylor College of Medicine in Houston, said. The scientific community has been raising the alarm about this since February, that airborne spread can happen, said Joseph Allen, an associate professor in the Department of Environmental Health at the Harvard T.H. Chan School of Public Health. So infectious disease experts were perplexed Monday, when the CDC scrubbed that section of the website of any mention of airborne transmission, writing that a draft version of proposed changes to these recommendations was posted in error to the agency's official website. The agency reverted to its previous language, stating that the virus is thought to spread between people who are in close contact with one another within about 6 feet. It remained unclear Monday afternoon when CDC would publish revised guidance on airborne transmission of the coronavirus. This is so destructive to this incredibly wonderful agency that we have loved and admired our entire careers, Dr. Ashish Jha, Dean of the School of Public Health at Brown University, said. This is amateur hour. Science evolves and is guided by what doctors and researchers learn over time, but clear messaging is critical to a proper public health response to the virus. The CDC is like a North Star in terms of guiding this pandemic, Weatherhead said. It's important that there is clear and concise communication so that everybody is on the same page. Hopefully we will get communication from the CDC to better understand why they're walking back on what we already know to be factual, she added. The federal government appears to have been advised of the possibly for airborne spread of the virus early on in the pandemic. This is deadly stuff, President Donald Trump told journalist Bob Woodward in a February 7 phone call. You just breathe the air and that's how it's passed, the president said, according to the Washington Post. Larger respiratory droplets, such as those emitted from coughs or sneezes, are likely the main drivers of the coronavirus.